Good evening. I'm here to talk a little bit about physical therapy and the role it could have with prevention of falls of those that are elderly. Just introduction a little bit. Have any of you ever known anyone that's at risk for a fall, or anyone that has fallen, especially an elderly person? It could be a pretty traumatic experience for them and for you, and can greatly reduce their quality of life. It could cause problems such as having to be in the hospital for extended time, no longer be able to take care of yourself, and possibly having to end up in an assisted living center home or other situations that are less than ideal at times for these people. So I'm going to talk a little bit about the benefits of this. I'm currently a physical therapist assistant at Logan Nursing and Rehab. I have a lot of experience with the elderly on a daily basis, and then graduated from the program in December from Salt Lake Community College as a physical therapist assistant. So I'm going to talk a little about some of my key points here that we're going to talk about, and teach a little bit about how to identify those that are at a fall risk, those individuals. We'll talk about fall prevention treatments and the interventions that we use in physical therapy, and then talk a little bit about the effectiveness of these treatments. In general, those that are at fall risk are the elderly group, those 65 years and older. There's different risk factors for them, including their physical condition, their home environment, things such as throw regs, lack of stair railings, things like that. Their health, balance problems, strength of their muscles, different factors such as those could be a risk for a fall. Different physical therapy tools we use to detect a fall are tools such as a time get up and go test, where we have a patient, we time how fast they can stand up from a chair, walk 10 feet, and then sit down again. We also have different balance tests such as a Tenetti test, a bird balance test. I can explain after the presentation if you have more questions. Different treatments that we use. We have different balance training techniques. We work on balance in different stances and challenge their balance system, help improve that. We teach people how to use canes and walkers and appropriate assistive devices that they may need to have better balance and to help support them better and make them more safe. There's also various tools to work on their vestibular training, the inner ear. That could be one of the systems that could be off track and can cause a lot of problems of dizziness and vertigo and different various things for these individuals. We also teach and educate the family, help them know how to take care of their loved one, help them with the things we've talked about with their doing these exercises at home for their balance and for their vestibular. Teach them to help use a new walker, teach them to know how to modify things at home to make them a little bit safer. To talk a little bit about the effectiveness of treatment and how this can things that I've seen of how much simple physical therapy interventions have helped reduce the risk of falls in the elderly. I've recently worked at a clinic in Murray that specialized in balance and vestibular. Had a chance to work with different patients there that had these challenges, who presented a really high fall risk coming into the clinic, and upon leaving had greatly reduced to almost none fall risk. Were able to go from not even able to get around their house without feeling safe to be able to go back to work and to the environment they were in and outside, and be able to do these kind of things safely. This is a great lesson that physical therapy can be for these people. Different evidence has shown this too, effectiveness of balance and vestibular training, how this can greatly aid and help them, these people. Currently I'm working at Logan Nursing and Rehab with a lady that suffered such problems, who wasn't able to get around before without any kind of walker, without help or anything, and now is able to walk around the halls herself due to these exercises. It's important for us to help our elderly loved ones and families, since we're often the ones that take care of them. Help make sure they have the care they need to prevent a fall. Physical therapy can be a value asset for this. The steps to get such help if you feel someone's at a fall risk would be first see the doctor, have them check out the different problems for a fall risk that they may see, and then have them, if they feel appropriate, refer to physical therapy and send them to us, and we would do an evaluation and go through the steps that we've talked about and see what we can do with the different tools to help aid their balance and ultimately increase their safety and their quality of life. So that's my presentation. If you have questions after, I'd love to share more about different exercises and different steps that you can do to help the elderly with their balance, and different tools of physical therapy. Any questions?